Welcome, everybody. We'll wait a few more moments for folks to log on and we'll go ahead and get started. Thank you for your patience. All right, we will go ahead and start. Good day, everybody, and welcome. My name is Rihanna King. I'm the Senior Public Advocacy Advisor here at Kaiser Permanente, and I want to thank you for joining us today for this important discussion about Kaiser Permanente's federal policy priorities. Today, you'll be getting a live update from Laird Burnett, our Vice President of Federal Government Relations, on what's happening in Congress and what we can expect in 2022. But before we begin, I want to introduce KP Voice for those of you who are joining us for the first time. KP Voice is a voluntary, nonpartisan grassroots advocacy community made up of employees, retirees, and physicians who want to speak up and make a difference on healthcare issues that impact people nationwide. Over 14,000 KP Voice advocates engage with their local, state, and federal officials on policy priorities that impact our providers, members, and the communities we serve. KP Voice advocates play a key role in supporting the strategy of our government's relations work. They've helped to pass legislation on healthcare reform, drug pricing, banning flavored tobacco, and so much more. If you aren't a member of KP Voice, please join us and raise your voice to impact the issues that our organization prioritizes. And with that, we'll move on to the main event. Today, you'll be getting an update on KP's federal policy priorities, hear about what's happening in Congress with the Build Back Better Act, and what you can expect in 2022. We'll also have an opportunity to go through some questions with Laird at the end of the discussion. And with that, I will pass it over to Laird Burnett.
Well, Rihanna, can you give me a thumbs up if you can hear me okay?
I can hear you.
Well, good morning or good afternoon or good midday, I guess, depending on what time zone folks are in. Thank you all for taking the time to attend and to listen today, and more importantly, thank you for the hopefully ongoing attention that you've been paying to public policy issues and support for our advocacy work that you all have engaged in. It's been important in lots of different ways. You know, there's been work at the state level and at the federal level, and folks have engaged in that, and it's been a huge part of our government relations advocacy work over time. And I, for one, can't thank you enough for the time and energy that you all, and interest that you all put into this. Let's certainly get rid of that picture and maybe go to the next slide. We'll sort of jump into the presentation here. You know, I may go off on a few tangents here and there because, you know, at this moment in time, the Congress is, well, actually the Senate is going through some of the issues we're going to be talking about, both behind the scenes in meetings that staff are having and trying to work out the Build Back Better Act, which I'll go into in a little bit, and on the Senate floor where they're trying to work through some of the major remaining issues of the day that they have to finish, that the senators have to finish before they can go home for their Christmas break. And hopefully to wrap up for the year, although that probably isn't going to happen the way they'd like it to. Anyway, so the point of all that is that there may be some live action over the course of the next hour here and there to comment on. You know, our federal advocacy work for, I don't know, the last 6-month period or for now, or this month or the last 2 weeks has largely focused on this set of issues that's described generally on this slide. There's a lot of work going into expanding health insurance coverage, preserving Medicare Advantage, and addressing high prescription drug costs and promoting integrated delivery systems. Now, this is sort of a snapshot in time. Of course, in our government relations work on behalf of Kaiser Permanente, we have broader issues that we are constantly either working on or planning for or are trying to be strategic about, or trying to help public policy process participants understand a little better, or understand our perspective, understand the impact on our members and our communities. And so we have proactive work going on universal coverage initiatives, on mental health, on affordability, and a series of other issues. And then we have ongoing work going on all the sort of major public programs that we participate in: Medicare, Medicaid, the exchanges, the Federal Employees Health Benefit Plan, other state level activities, commercial market rules and requirements that are both state and federal. So all that stuff sort of goes on permanently. But these are 4 sort of issue areas that are live now and that we're sort of working through in various different ways. Let's go to the next slide, if we could. And then, I think I can turn pretty quickly to what's happening in Congress, and you'll get a sense of sort of how those broad issue categories translate into something more real. So let's go to the next slide, and we'll talk through. So the main things that are still to be done by this Congress, I'm kind of focused on the Build Back Better Act, which is President Biden's title and his extremely large legislative package that really represents the Democrats, President Biden's and congressional Democrats' agenda for much of this year. It ranges across, some very important healthcare issues, but also across the tax code, through some other issue areas that we follow and care deeply about, so like nutrition, climate change, housing programs, some federal tax provisions that support families, all of which are important to the communities we serve and part of our sort of larger agenda, are there. So the issues I'm going to talk about in a few minutes under the Build Back Better Act rubric are more focused on the healthcare issues that sort of directly affect Kaiser Permanente, but there's a huge set of issues in this bill, and the version of it that the House passed, I think, is something like a $3.7 trillion enterprise, and it's been skinny back to just under $2 trillion, and the Senate will probably skinny it back some more, but there's, that's still a sort of record-setting size for a single piece of legislation, and the number of issues involved is pretty huge. So we'll go through that in a little more detail in a minute. A lot of the work on that right now is going on at the staff level or in the committees of jurisdiction. So it's not so much a public thing at the moment. The Senate will turn back to it in depending on how these other issues go, in a week or two, or potentially after Christmas and before New Year's, and ruin a bunch of members of Congress and congressional staffers' holiday plans, or it could even spill into the next year. The other sort of major items that Congress still has to deal with, they have tackled, at least for the next 2.5 months, the issue of funding the federal government. So the federal fiscal year actually ends at the end of September. So since October 1st, the federal government's been running on a series of what are called continuing resolutions, sort of short-term appropriations bills that keep the departments of government funded. And we always follow those pretty closely because they very often become vehicles for healthcare provisions or other provisions that we care about that might not be directly related to the appropriations process. But the House and Senate passed a bill, well, last week, I guess, and which again temporarily extends funding for the federal government through February. So they'll come back to it in February, and that very large piece of legislation could become the vehicle for some additional healthcare related provisions, or they could try to keep it clean. But it's always an interesting sort of legislative process to see what's going to happen. And then another major issue that they still have to deal with roughly December 15th is raising the federal debt limit. So this will probably get done and attached to another piece of must-do legislation sometime in the next week or two. It's one of those situations. Well, it's being worked out in the Senate, and apparently they're close to finishing up that process. But again, when a debt limit extension has to go through Congress, it can very often become the vehicle for other things. In past go-rounds, folks on the more conservative end of the spectrum, or fiscally conservative end of the spectrum, have sometimes demanded cuts in spending in order to accept another increase in the debt limit. We're not having that kind of debate this time around, but we always try to track that pretty closely and see what gets attached to it or what kind of conditions are put around it. So let's go to the next slide. We can talk about some of the issues specifically in the Build Back Better Act, which you may have heard referred to as the Reconciliation Bill or the Social Infrastructure or Soft Infrastructure Bill. There have been lots of different names for it over time, but it's actually the actual title of the bill is the Build Back Better Act, as hard as that is to say repeatedly and clearly. It's a bit of a tongue twister. But like I said, it ranges across most of the functions of government, but there are some very specific healthcare provisions that in the sort of normal legislative process, each one would be a substantial legislative accomplishment or a substantial bill of its own. But they're all sort of lumped together into this one big piece of legislation and are moving forward together. So under the sort of category of expanding insurance coverage, Congress earlier this year passed something called the American Rescue Plan, which was a pretty direct response to the economic crisis and public health crisis around COVID. And in that context, they both expanded the amount of subsidies available under the ACA, that is, subsidies that are available to people who buy their insurance through exchanges individually, not through an employer group, generally speaking, and not through some other public program like Medicaid. And so they expanded the amount of the subsidy and they expanded the eligibility for subsidies. But that was a temporary program. So Congress is now discussing an extension of that, which we strongly support. It's resulted in millions of people either keeping their coverage through the economic crisis related to COVID, job loss or people moving around from job to job, or companies actually going away. So a number of people have found coverage through the exchanges or certainly a higher level of financial support through the exchanges so that they could maintain coverage through the last year and a half or so. That's a pretty popular thing to do, and is one of the provisions that is motivating, I think, a lot of folks on the Build Back Better Act. So we don't expect any changes there. The only risk on that is for the larger legislation. There is another provision in there that addresses something called the Medicaid gap. And so, again, this is related to the Affordable Care Act. And there are about roughly a dozen states or so that never expanded the Medicaid program fully as the ACA allows. So there are folks who are sort of stuck between Medicaid eligibility and eligibility for exchanges in the subsidies in the exchanges. And so this is an effort by Congress at the federal level to create a program in those states that have not expanded Medicaid that would essentially allow people to enroll in completely subsidized coverage through the exchange. And again, we support this. The only state in our footprint that is directly affected is Georgia. But there's some pretty big states that have chosen not so far to expand Medicaid that include like Texas and Florida, North Carolina. So they're pretty big chunks of the population and millions of people involved here who would newly have coverage. They don't have it now. So we strongly support that provision. There are pretty substantial drug pricing reform provisions in this bill. It's a bit of a moving target. At the very beginning of the legislative process, the reforms were much more ambitious. The central reform here is to allow the Secretary of HHS to negotiate prices in the context of the Medicare program, Medicare Part D. That is still the central concept in the drug pricing reforms in the bill, but the scope of it has gotten a bit narrower. So approximately 10 drugs each year would be subject to negotiation by the secretary, and there's some limitations on which drugs the secretary would be able to select for negotiation, and then those prices would be available to all participants in the Medicare program. We support the larger effort at drug pricing reform. We are generally supportive of the concept of secretarial negotiation over drugs where there is no competition or no effective competition in reality, and where there's been egregious pricing behavior by manufacturers. So by and large, this should be a good thing. It also would allow us to continue to try to negotiate lower prices on our own behalf. So it does leave room for us to do that. There are substantial provisions affecting the Medicare Advantage program. Oh, I'm sorry. I'm skipping down one. Protecting Medicare Advantage. So, Congress, when they get into these large healthcare bills, they generally try to, pay for the costs of new programs or program expansions. And one thing we've been worried about is that Congress might try to use Medicare Advantage payment reductions that would affect our members and our own ability to operate and to offer the benefits that we offer through Medicare Advantage. They might try to use savings in that program to offset some of these other costs. They have not done that so far, and which is a good thing, and we will continue to work to keep that the way it is. Then there are some provisions that would improve the Medicare program broadly, and these fall into sort of two major categories. One is a rewriting or sort of a restructuring of the Medicare Part D drug benefit. So Congress would create for the first time in Part D a maximum out-of-pocket amount for seniors of $2,000 a year. So there would be a cap on out-of-pocket costs, which is a good thing. And then they would, underneath that, sort of restructure the way the risk for that benefit is distributed. As it was originally conceived roughly 20 years ago, the federal government picks up a fair amount of the cost of the insurance risk for that benefit. And so they would redistribute some of that between the Part D plans, which includes us, drug manufacturers, and then the amount that the government contributes through the Medicare Trust Fund and the amount that seniors are expected to pay. So our goal there is to make sure that, of course, we strongly believe that the $2,000 out-of-pocket maximum is past due and is a good thing to do to protect our members and seniors. And then in that sort of redistribution of risk, we want to make sure that beneficiary premiums are not increased. And that's sort of a mathematical exercise. It's a bit of a formula. So it's not really something we control. If risk is redistributed in, one way or another, it would require us to increase premiums because it's a formula. So we're trying to avoid that. So our goal is to help the congressional staff who are doing this understand the impact of the sort of mathematical changes they're making. So far, that seems to be in a pretty good place. And then the other sort of general improvement to the Medicare program that they are contemplating is to add some new benefits to the basic Medicare benefit for the first time in a long time, really since Part D, the drug benefit, was added. This started out as a discussion over dental, vision, and hearing benefits and adding all of those to the basic Medicare benefit. Where they've ended up now is the addition of a modest hearing benefit. And they have decided that Congress has decided that the dental and vision benefits were too expensive, and to try to do all that at one time was logistically pretty difficult. So at some point they will come back to those issues in another context, but for now, they're really just talking about adding a hearing benefit to Medicare. And then, like I said, there are a series of other issues where Kaiser Permanente has been active in our communities that go well beyond sort of direct healthcare programs and healthcare policy, and that includes climate change, nutrition, family support through the tax code, and housing programs. Now, there are lots of other issues in the legislation where there's additional funding, say, for mental health services that are, that go through communities and state block grants, which we care deeply about and support. But those are kind of the major ones where there's still discussion and where there will be sort of the broadest impact. Let's go to the next slide, and we can talk a little bit about what we're expecting to see next year. It's a little, it's always dangerous to make predictions about what's going to happen in the future when it comes to politicians and Congress and sort of events as they have yet to unfold. And next year is going to be a really interesting year. It is an election year in Congress. So all the members of the House and 1/3 of the senators will be up for re-election. And we right now, the closer the margins in House or Senate, the more hard fought an election is going to be, because both sides see the current majority sees the potential for the majority to slip away and control of that chamber to slip away. And the party that's in the minority sees an opportunity, of course, to pick up the majority and have more say about what the federal agenda is going to be. So the majorities now are about as slim as they could ever historically possibly be. And in the Senate, there's a 50-50. Actually, nobody has the majority. The Democrats enjoy the majority status because when there is a tie, the vice president gets to vote, and of course the vice president is a Democrat. So the Democrats have majority status in the Senate, even though it's really 50-50. And in the House, it's 221 to 213. So all it would take is 4 or 5 votes for seats to flip for the majority in the House to flip, which means that 2022 is very quickly going to, maybe after February or March, is going to slip pretty quickly into election mode, where we don't expect Congress to accomplish a whole lot, maybe argue more vociferously, but not accomplish a whole lot. Right now, things are not looking particularly good for the Democratic majorities in Congress. They've got two things working against them. One is history. The party of the president in the first congressional election after that president gets elected almost always loses a substantial number of seats in Congress. So Joe Biden got elected 2 years ago. The historically consistent thing to expect would be for his party, the Democrats, to lose a substantial number of seats in the House and Senate. So that, combined with all the polling that's out there about President Biden's popularity, which has been slipping, and about the relative popularity of Democrats versus Republicans generically in Congress. And Republicans are in a pretty good spot. Of course, elections a year away, so anything can happen, and a lot depends on the actual candidates and how good the candidates are and what the issues are at the time. But we are, as we think about what happens beyond 2022, we have to think about two potential roads. One is Democrats hold majorities. The other is Republican take majorities in Congress. And of course, longer term, that has a huge impact on President Biden's ability to get anything done that requires legislation. Anyway, so with all these slim majorities and historical factors and moving, polling status, it's going to be a hard-fought election, and it's pretty quickly going to take over the agenda in 2022. If we can go to the next slide, we do still expect some activity. Of course, the outcome on the Build Back Better Act, which I just went through, is going to have a huge impact on next year. There is the possibility that consideration of that legislation could spill over into 2022, which means that in January and February we could still be working on the same set of issues. So that would, of course, throw other things off and farther back in the year. And then a number of the programs in that Build Back Better Act would be extended or created for a year or 2 or 3 at a time. And some of those, the length of existence of those programs, some of them are still up in the air as the Senate works through legislation. So it's possible in 2022 we could be working to extend some of the items that were passed in the Build Back Better Act itself. So there's the Build Back Better Act. There is the state of the pandemic, of course, which will have a lot to. Well, there are both public health measures that Congress and the Biden administration may have to consider depending on the status of the pandemic. And then if things are bad, there could be continuing sort of efforts to deal with the economic fallout. But hopefully it won't go that way. Hopefully it won't go that way. And then we expect actually an acceleration of regulatory work from the Biden administration. What I mean by that is that President Biden's full team at HHS, for example, has really just gotten into place and has begun to work on some of the initiatives they would like to accomplish through the regulatory process that does not require Congress's input. And some of that could involve working with the states. States that want to expand coverage or address affordability could ask the federal government for waivers. And of course, the Biden administration will take a very different approach to those waivers than the Trump administration would have a couple of years ago. So we expect, some interesting things to happen through that combination of state and federal activity. The administration also has the ability to affect Medicare program rules through sort of an annual process of putting out new regulatory requirements, and certainly, Democratic administrations tend to um, uh, um, look more closely at some of the regulatory issues that consumer groups might ask for. So they just have a very different approach from Republican administrations. So we could see some changes in Medicare rules there. And then there's a whole slew of transparency requirements that were either initiated by the Trump administration through existing regulatory authority or included in legislation that was passed at the end of last year, including some surprise billing requirements and accompanying material. So that would require disclosure of prices by health plans and by hospitals and providers and so on. And a whole series of similar measures, which were still coming online and which have been delayed as the new administration came in. So we expect to see some pretty intense activity there. Let's go to the next slide, please. Oops, and actually you can go back one. And then there are a series of other issues, which I didn't include on this slide, that we could expect to see next year that might even work as sort of bipartisan issues, where there's interest on both sides of the aisle to maybe make some progress. One big area is in mental health and substance abuse. Of course, the pandemic has increased demand for services. The opioid crisis that Congress attempted to address 4 or 5 years ago continues to be a crisis and was probably exacerbated by the pandemic. And of course, our mental health system, even before the pandemic, is arguably not equipped to address the growing need for services. So there's a whole series of issues there, expanding the workforce, funding for services at the state and community level, crisis response, suicide prevention, whole series of issues there that Congress is interested in addressing. There's more work to be done on the public health infrastructure and the supply chain related to public health and to the pandemic response that we expect Congress to dig into maybe a little bit at a time next year. And then once the public health emergency ends, Congress will probably take an even more comprehensive look back at the response to COVID and try to strengthen the public health system in a thoughtful way. So that I expect that to happen in several bites over the next few years. And then, like I said, transparency issues, postal reform actually is an issue that we cover federal employees. So we cover a lot of postal workers, and there may be some changes in their health coverage as a result of some larger postal reforms. And then a series of other discrete issues. But so there is some hope for substantive legislation next year. It won't be on the scale of the Build Back Better Act or the American Rescue Plan that we've seen over the last year or so, because in large part because of the election year climate. But we expect to be busy and to have a number of interesting issues to work on. Let's go to that next slide, and I'll getting close to the end here. So, depending on how the final chapters of the saga around the Build Back Better Act unfold, we may be coming to this community to ask for help. Changes in the Senate could be substantial, and it could end up going back to the House, and there could be a extended debate that takes us even into next year. So. We will continue to keep you all updated on, the important issues that we're following and our priorities in these larger bills and the permanent priorities that we try to follow and keep up with. So in advance, I would say thank you for your continuing attention to all that. And I think with that, I should probably stop talking and maybe we should try to take some questions.
Thank you, Laird, for that wonderful presentation and overview. We have a lot of great questions rolling in, so why don't we go ahead and get started? Um, the first question I see is, does KP partner with other organizations who match our mission on our advocacy efforts?
We absolutely do. I mean, the reality of working, the United States of America is a very big country with lots of interests and large organizations and large groups of people that care about things and see things very differently. And we have a vital democracy. So in order to get things done at the federal level, the most effective way to do that is to work in coalition or in combination with people who have the same interests. So we work in partnership with organizations that are similar to our own very unique organization on discrete issues. We work with trade associations and professional organizations constantly. We work with AHIP, which represents the health plans. We work with the American Hospital Association, which represents all of the hospitals in the country, of course. Our physicians are active in the AMA and a wide variety of physician professional organizations and groups that represent physician groups. We work in ad hoc coalitions on different issues. So we are part of a group that I'll probably get a chance to talk about more as we go on, called the Coalition, CSRXP, the Coalition for Responsible Drug Pricing, and which is a whole, we were actually one of the founding members of this group, and it's been one of the entities that has helped push drug pricing, to the top of the public policy debate. And so they're now, their health plans, employer groups, labor unions, consumer groups, AARP, a wide variety of interests have gotten together in that coalition to push the broader issues of drug pricing forward. We're part of a coalition that worked on surprise medical billing. We're part of coalitions on all kinds of different issues. And so, half of the work is to identify the people who have similar interests and identify the issues that you have in common, and then find a way to work in larger combination. I will say, though, one of the really kind of fun and challenging things about working for Kaiser Permanente is that we are a very unique organization. The way we pay providers internally, the fact that we're not a fee-for-service oriented delivery system, the integration of care across the whole organization is still pretty unique in the American healthcare system. And so a lot of policy making is kind of done with that fee-for-service model that dominates in most of the country in mind. And so very often we have to find ways to adapt, public policy that's being made for the whole country to what we do. And there are a few other organizations in of substantial size that are similar to ours, but not many of them. So sometimes we are out there on our own. So I hope that kind of gives you a picture of sort of all of the above. We work in all these different ways. We try to work in combination with partners where we can. And then, sometimes, though, we have to represent the unique needs of Kaiser Permanente on our own.
Thank you, Laird. And so our next question is, the Biden administration is putting an emphasis on maternal health care and the extension of Medicaid services for 12 months postpartum. A number of our Kaiser states are opting for this extension. Is Kaiser engaging with HHS and CMS on best practices for improving the health of women during the postpartum period so they'll be in better health for themselves and subsequent pregnancies?
Well, that's a very timely question. There's actually some activity going on today at the White House, but I'll talk about that in a second. So in the Build Back Better Act, there actually are provisions that do exactly what the questioner is asking about, which expands the Medicaid benefit across all states to a full year of postpartum care. And we support that. It was part of a legislative package called the Momnibus, the play on the word omnibus, which is a series of provisions that are intended to address the issues of maternal mortality. And so there are, the Build Back Better Act has some pretty good provisions there, and we support those, and we've made that known to people. And they're pretty wide. Those provisions are pretty widely popular. The activity today is the Vice President is holding an event at the White House today, a call to action on maternal mortality. And they asked us and a number of other organizations across the country for examples of work that we're doing to address maternal mortality. So we were able to participate in that event with an announcement about expanding some remote monitoring services that we do in a couple of our regions to all of our markets. So we got to work with them over the last few days on preparing for that. So you may see some stuff in the announcements that come out of the White House today about their call to action. So a lot of work going on that front, and I think even the Build Back Better Act passes with those provisions in it, I suspect that Congress will want to do more on this front, and then on the implementation of these provisions, there'll be some action as well.
Great. And this next question you touched on a bit. So it's about the Build Back Better proposals to include coverage for hearing aids and dental, which I know you said is on pause for now, but still going to be a hot topic going forward. So the question is, what is KP's strategy on this issue? And will KP consider expanding dental beyond KP Northwest?
Well, I think there's several issues sort of wrapped up in there. We were, well, let's see, on the issue of expanding the basic Medicare benefit to include dental and vision and hearing. We're essentially neutral on that. Many of our members through the Medicare Advantage program have supplemental benefits that address those areas, maybe either more comprehensive or not as comprehensive as what was being proposed in Congress. So our real focus there was to make sure that operationally, whatever Congress was going to do is something that made sense, and that we could do properly, and so far all of that, that was all fine. Congress will probably come back, probably when there are Democratic majorities, to try to expand the dental and vision benefits. Frankly, the reason the dental benefit fell out of the the dental and vision benefits fell out of the Build Back Better Act was about the cost. There's some complexity issues there if they try to do it too quickly, but it really came down to some decisions that they had to make about how much they're going to spend in different parts of the bill. There's some other, I think some of the other issues sort of wrapped up in that question, or what is Kaiser Permanente going to do, even if Congress doesn't change the law, to make those benefits available to more of our members. And those are really outside of the purview of government relations, but I know that people are constantly looking at ways of improving our Medicare Advantage offerings to make benefits more attractive and more comprehensive for our members. And dental is one of those areas that is under constant review. And so in a number of our members, it differs from market to market, and it differs based on the source of one's retiree health coverage. But a number of our members already have a fairly comprehensive dental benefit. And then another piece of that is, of course, in our Northwest region, there is, we actually provide dental care directly, but we don't do that in our other markets. And again, that's really outside of the government relations purview here. But I think the organization is constantly looking at strategies for, improving what we can offer to our members, and those dental services are um, reviewed on it occasionally. So, but I couldn't speak to any specific plans there.
Thank you, Laird. We have a lot of questions on prescription drugs. So I'll kind of combine a few here for you. Um, will Kaiser be advocating for lowered pharmaceutical costs as one of our top priorities? And how might the proposals that are in play impact our members? And then I'll just add on with that, with the lobbying power of the pharmaceutical industry being extraordinary, how is KP planning on accomplishing our goals in reforming high prescription drug costs?
Well, so a lot of the way we're set up and the way we tend to structure our benefits and on the drug side is people have copays, of course, not all the time, but uh, copays as opposed to co-insurance. So they're generally protected from some of the higher out-of-pocket costs that they might have in another situation. So the problem with out-of-control drug prices is that that all goes into the premium that we have to charge to all of our members. So it does, when pharmaceutical manufacturers bring new drugs to market with outrageously high initial prices, or when they constantly increase prices with no particular justification, all of those increased costs go into the premiums that we have to charge our members. So we have been pushing for years to address drug pricing reforms across federal and state government, and in order to sort of address the larger issue of affordability. So that's really what it comes down to for our members. And as to how we are going at this in the face of pharma's vast resources, I mentioned earlier that we are part of a coalition, CSRXP, which we helped start up, and which represents a broad swath of organizations that have various interests in drug pricing, everything from consumer, labor, employers, health plans. Has worked pretty effectively to bring these issues to the fore. And we are now having a real debate over some drug pricing reforms for the first time in 20 or more years. So, of course, pharma is pushing back and will continue to do so, and that's how the process works. And so, there will be an effort to include these provisions in the Build Back Better Act and enact those into law, and then there will be a robust process of implementing those provisions with regulatory, fights over regulations and exactly how that'll be done through HHS. And then there are plenty more issues to pursue after that. There are patent reform issues that would need to be addressed that are not necessarily through HHS. There are legal issues. There's all kinds of different routes still to go, and so this is not a one and done kind of debate. We expect this to go on for years, and for a number of different issues to be addressed over time. And it's not just a federal issue either. So there have been substantial efforts at the state level as well to deal with drug pricing where possible. So lots more still to come on that.
Thank you, Laird. Another question that came in is, how do you expect California to fare within the Build Back Better Act? And I might just add on, I'm sure you're monitoring this for all of KP's footprint, kind of how are we feeling about our footprint in the Build Back Better Act?
Sure. Well, there's so many different provisions and priorities that are all wrapped up into this one major piece of legislation. We would expect California to benefit hugely. That's not too strong a word. If we are successful in keeping the expanded exchange subsidies in place, um, um, the climate change issues, the housing, nutrition, um, what else? Child tax credit issues that have actually brought millions of children out of poverty already in their temporary form from the American Rescue Plan will all have impacts in all of our states. And of course, the housing crisis in California, the desire to engage on climate change in California are all huge issues. So assuming that the Democrats in Congress are successful in getting this legislation through, is the implications and the amounts of money that would be available to address problems that they've identified will be significant and start to show up in a year or two or three as programs benefit from those expansions. So I would expect all of our states to feel the impact over time. And then I guess the one thing I would point to in a state other than California is in Georgia. There's this issue to address the Medicaid gap. There's a substantial population in Georgia that right now is essentially uninsured because they fall between Medicaid eligibility and subsidies for the exchange, eligibility for that. And that would have a meaningful impact on tens of thousands of people, and would be good for our ability to serve members in the state of Georgia. This is a little different from the American Rescue Plan, which I've referred to a couple of times, but there was direct assistance to the states there because that bill was more about the immediate economic response to the pandemic, when states were struggling to fill budget holes and unsure of whether they're going to be able to meet their existing obligations. So California did substantially benefit, and a number of our states substantially benefited from direct assistance there. The structure of the Build Back Better Act is a little bit different. It doesn't have that sort of direct aid to states. It turned out California actually is doing pretty well and has a budget surplus, which is good. But the Build Back Better Act is more about supporting programs, and a number of those programs, of course, are important to us and important across all of the states. So there's benefit, sort of issue area by issue area, I guess is how I would put that. So I hope that answers the question.
It does. Thank you, Laird. And then one last question as we approach the end of our time here. We got a lot of interest on the issue of telehealth. So is KP engaged in any legislation on telehealth, and where do you see this issue going in 2022?
Right. Yes. Yes. The short answer is yes. We are engaged. The one thing is, of course, we expanded the use of telehealth extensively because of the pandemic. We already were heavily committed as an organization to expanding the use of telehealth in our integrated context. A lot of what Congress is going to need to do on telehealth in the short term, we can already do. I mean, this gets kind of technical, but down in the weeds. But Kaiser Permanente participates in the Medicare program through the Medicare Advantage program. So we receive capitated payments from the federal government to provide the services we provide on a prepaid basis to our Medicare Advantage enrollees. We are not by and large in the fee-for-service Medicare program. We do provide some services that way. Our hospital emergency rooms take, when non-members come in who happen to be in Medicare, will receive fee-for-service payments. But the vast majority of our participation in Medicare is through that Medicare Advantage program. And we already have the flexibility there to do most of what we need to do to do telehealth right in our organization. There are still some issues around state, licensing of providers across states, and then technical issues about originating sites and so on in the Medicare program, and some of those have been addressed through flexibilities that were made available because of the public health emergency. And Congress will have a discussion about how much of those to extend once the public health emergency ends, and we will, we'll be part of those conversations. But we're in a better position than most of the healthcare system to put telehealth into, to robustly use telehealth through the Medicare program. On the issue of cross-state licensing, because that comes up a lot, it would be great if there was national licensing of physicians, but realistically, that's far off. And so we have for years worked with a group of states in something called a national compact, which is where states get together and meet a certain agreed upon standard so that physicians can work across state lines in those participating states. And so we've tried to work at the state level to get our states to participate in that with some degree of success. So that helps. And then, of course, inside our organization, there's been a lot of work done to, under the existing rules, to allow physicians to work in more than one state. And that's been done fairly successfully, but it does take a lot of extra work. So telehealth, is going to be a growing area, and we are, again, Kaiser Permanente is kind of a special organization and unique in, of course, our integration, and we are able to integrate those benefits into what we do. The way telehealth is going to work outside of an integrated organization like ours and the fee-for-service system is largely what's going to motivate Congress, and so we're going to have to differentiate ourselves on that, and so it could get a little complicated over time. Anyway, we stop there.
Well, thank you, Laird, for taking the time to give this presentation and providing such thorough answers to the questions that have been posed today. We really appreciate you coming and joining the KP Voice community today. And thank you to all who have participated in KP Voice. You've made an incredible impact on policy issues that will improve the health of our members and the communities that we serve. But as you heard today from Laird, there'll be a lot more to advocate on in the coming years, and we will continue to need your help. And if you're not a member of KP Voice, please consider joining us to make sure your voice is heard on these important issues. We look forward to working with you all next year, and thank you again for joining us today.